Hi, Niklas.
Hi, Anni.
So we're now in Helsinki in our lab at CurifyLabs, and we want to talk about the research and development work we do in-house, really to offer this comprehensive solution to our customers.
Yeah, it's going to be exciting.
Yeah. So there are multiple components that we're talking about, right? And all these areas need to be developed and worked on.
Yeah, it's not a simple solution, really. What we're offering, the CurifyLabs compounding system solution, is really a combination of several technologies. So we have the pharmaceutical excipient bases, right? And which become formulations when the API is added into them. And then we have the software that runs basically everything. We have the hardware, which is basically robotics in the way that we have the 3D printer, but then we also have other devices making it the complete process, right?
Yeah.
And then we have the quality control that's integrated into the system as well. So it's a very comprehensive package.
And it hasn't been easy to build this type of solution, and pharmacies are really in need of it. And it means that we have a lot of expertise in-house, right? So
yeah, I mean, obviously it involves, competencies from different fields. We have pharmacists, we have software engineers, we have hardware engineers working together to solve this fairly complex sort of workflow and issue with the solution.
So what does the pharmaceutical development work really entails and contains?
Yeah, that's basically, we've structured it very clearly. So first of all, we typically get the input from customers. There's customer feedback that really governs what we do in the lab, what type of formulations we develop. But in the core of everything is the pharmaceutical excipient bases, right? So we have developed many different types of bases that then cater for different types of APIs, and then of course also different types of dosage forms. So those are the bases of being able to then produce formulations and dosage forms for our customers. And how we then start developing formulations, it is by defining a target product profile for each drug. And that governs then what we do in the lab.
And it's almost like a mini drug development process, right? So we do all of these steps that would be part of a standard drug development process, but in an agile, speedy way, really to meet the needs of the customer. And the whole package is then there, right? The quality and everything.
Yeah, exactly. So let's take a formulation. Let's say furosemide formulation for pediatric use. We start by developing the target product profile, then follow basically that to start the testing of how much drug loading can we put into the excipient base. Then we do technical testing with the printer, how to really optimize the parameters for printing so we get 100% accuracy in the results. When we have basically validated that process, so there's a process validation step, then we start stability studies with those formulations. And then that has also involved quality control method development. Typically, we develop and validate HPLC methods to make sure that we can do stability studies and chemical analysis and monitor basically the stability then typically up to 6 months, sometimes even more. And that then produces the quality documentation that goes with every formulation in our formulation library.
And besides these bases, as we're offering the kind of full concept to our customers, we need to develop the software and the hardware and then these additional accessories. Do you want to describe a little bit about the hardware and software development? And
yeah, so basically, actually everything that we do is a very structured process from a quality management point of view, because we have a certified ISO 13485 quality management system, which means that we follow a so-called design and development process, which starts with the inputs, let's say customer feedback of a feature that we need to develop. We develop it, we test it, we validate it, and when it's ready, it's launched to the customer. So we always follow that, and that's also a testament in a way to our customers that because we have it in place, the customers can trust that everything that we offer the quality is there in the product. Basically, that governs all the pharmaceutical work, the software development and hardware development, and all the teams are aligned in terms of that way of working.
So it's kind of a novel way to bring these pharmaceutical solutions to the market. So there's the GMP and how the pharmaceutical world has been following that standard. We now also have the ISO standard that we follow. Is that one of the uniqueness of the research and development work we do here? If you compare to other health tech companies, what do you think of that?
I think at least in this compounding space, that's a unique feature that we have, because we need to combine these different aspects in a specific way. And one unique feature I would say is also the way we work in an agile way, and that has come from the software development side. So we basically have processes that have been established on that side, which are really sort of move fast in a way, and you iterate fast, and then you launch things, and then you develop, and then basically that's a unique feature that I think we've been able to build into our processes as well.
And hopefully that's visible to our customers, that they get the solutions and improvements that they can use in their everyday life in compounding.
Yeah, I think that's something we've actually put as a feedback many times, that people are a bit amazed that, something is already ready.
Yeah. A lot of hard work, a lot of expertise in many fields. So a lot of things happening here in Helsinki. So
yeah. Thanks, Anni.
Thanks, Niklas. And thanks for joining. There's going to be more of these vlogs coming out where we describe the work and life at CurifyLabs and how we work with our customers. So stay tuned.